So you've all decided to come and join us at Re-conceptualizing Prenatal and Postnatal Care and Community Support panel, which is going to be with Ms. Simone Lee. She is a DONA trained birth doula, lactation consultant, and owner of Birthing with a Purpose, LLC. And we also have Ms. Abigail Santiago, who is a PASOs Community Health Worker. And our guest who is going to moderate and facilitate this particular panel is Dr. Amy Williams. She is an assistant professor, pediatric nurse practitioner, and medical provider for the South Carolina First Steps School Readiness Board of Trustees. So welcome, ladies. We're so happy to have you with us today. I am going to now turn it over to Amy and get started with our panel discussion.
Thank you so much. I'm so delighted to be here with each of you today. And for those of you watching the recording, so excited that you've chosen to take a listen to what we are talking about today. It is truly my pleasure to be here with two professional colleagues of mine. I live in Charleston, South Carolina, so I'm in the Tri-County area and get to have direct linkages to the programs and supports that we're going to be talking to you about today as a pediatric healthcare provider within our community. So it gives me just such great pleasure to be with both Simone and Abigail today, whose services I've been lucky enough to call on for patients that I see in practice. So I wanted to just give a little bit of framework, I guess, and background before we get started. I wanted to expand a bit on the introductions that were provided today, because I think some of the information that I want to share with you will be really helpful in understanding how we work through these programs and how we really bolster this prenatal and postnatal period in our community. So I know that we mentioned that Ms. Simone Lee, is a birth doula, lactation consultant, and also an owner of Birthing with a Purpose. Ms. Lee, it's also worth mentioning and very important to mention that she works with children and families through age 5, and she'll talk a little bit more about that. But just wanted to make sure that I was really laying the framework that Ms. Lee's work does encompass the birth through 5 age group as well. She has the fortune of sometimes getting to work with families and mothers from pregnancy until their children are 5 years old. This also is work that she does within the community. Much of the work that she does is really helping patients and helping clients that may have been victims of trauma at some point in their lives, and how that traumatic experience may otherwise have shaped their parenting and their pregnancy in a different way. And so I'm really excited to have Simone share with you some of the cultural responsive and trauma-informed care that she's providing in the community. Simone is a true advocate within our community. She is working on the ground each day with families and with children with that trauma-informed lens, and also as an advocate in our community. Abigail, I'm fortunate to get to work with a bit more closely because she works on a program that I'm intimately familiar with. The clinic where I provide care has a majority first-generation Latino population of children and families. So we got to work together beginning, it's been close to 10 years ago now, on this program where Abigail is a community health worker, a PASOs trained community health worker, and she does home visitation for children that are in Spanish-speaking homes. The program is really designed for children ages 0 to 5. It goes into the home. It's home visits going into the home, really looking at health, education, developmental milestones. She administers developmental screening tools, and really looks very holistically. I always say that it's what I wish I could be doing as a nurse practitioner. I wish I could be there in the child's natural environment, really getting a better idea of what goes on a day-to-day basis within the home, and help support parents and meet them where they are with their parenting and caregiving needs as this rapidly changing child unfolds their first 3 years of life. So Abigail is truly our eyes and ears on the ground, going into homes and really meeting families where they are and giving them next best steps on ways to enhance their children's development and ways to provide care that will help them be ready kindergartners. So with that, I wanted to give both Simone and Abigail just a moment to give any other brief descriptions of their work that I may have left out. And after that, we'll jump right into the questions that we've prepared as part of this panel presentation today. So I'm going to go in alphabetical order just to keep things organized. So Simone, could you please just jump in and, everyone can hear your voice and speak a little bit more to your introduction.
I thought that meant that Abigail was going to go first.
Oh, sorry. I did it by last name.
No worries. Greetings, everyone. My name is Simone Lee. I am a South Carolina native. I was born and raised in rural Berkeley County, Cross to be specific. I'm a mother first, so that gives me that lived experience of being able to contribute and to understand other individuals' lived experiences. Mother of three. I have a degree in psychology from the College of Charleston. I am a DONA and National Black Doula Association birth doula. I'm a certified lactation counselor, placenta encapsulation specialist, and childbirth educator. Through my work with Birthing with Purpose, as well as with Berkeley County First Steps, I have the unique ability to be able to work with a wide range and diverse population of individuals from preconception to that 5-year-old mark. I'm also a Choose Well family planning health practitioner, so I'm able to work with families as they journey to parenthood as well, and able to provide that groundwork and the necessary information to be able to guide them into parenthood. And once they have birthed their children, I'm able to assist with lactation. And I'm also the facilitator of our Nurturing Parenting program, which allows me the ability to be able to work with families as they journey further into parenthood, to be able to give them nurturing parenting skills and to give them resources and tools to be able to parent in a way that may be different from what they may have been parented previously. So I thank you both again for the opportunity to be amongst you and to be able to give my perspective and to lay the groundwork for the amazing work that we do in the community.
Thank you so much, Simone. So excited to be here with you today. And I want to turn it over to Abigail next to expand a bit on her introduction and include any information that is most important as we begin our work together today.
So like Amy mentioned, I'm a community health worker for PASOs and Berkeley County First Steps. I mainly work in the Berkeley County area. It's part of a program called Connections for Child Development. That's connection with PASOs. And mainly I do home visitations for families that are in the area. And these referrals can be from participants themselves. They can call me, and if they're interested in a home visit, I can go. Or sometimes, like Amy mentioned, the referrals from providers at MUSC. It just varies. Or other organizations in the area. And when I go, I think one of the things Amy mentioned was when you go into the home, that you see things you don't really see in the clinic, and you get connected with families at a more personal level of where they feel more comfortable of sharing of asking for help if they needed help with other resources available, or also you seeing if you could connect them with services. So yes, I do screenings, but I also connect with a lot of services available in the area. And sometimes it is a lot of education about services that are available to them that they may not be aware of, that they can connect with. So I think a lot of it is just connecting and helping and education.
Thank you so much for that. So with that, I wanted to move into the questions that we've prepared for this session. And each of our panelists, both Simone and Abigail, will answer these. And the first is, tell us about how you cultivate and facilitate a strengths-based approach for participants and families that you serve in your work. So I'll hand it over to Simone first.
So the very first thing that that I do to make sure that we build strength-based programming is that we make sure that we value individuals' life experiences. So we go into the individual's personal space. So I also have the opportunity to do home visitations as well, both through my work as a doula and through the Nurturing Parenting program. We go in and we honor individuals' lived experiences. We also make sure that we are offering evidence-based programs and educating individuals on the opportunities and the resources that they have, and also just being able to build relationship. I think that it's so important for us to be able to build rapport with families. Families have to be able to trust you. And once they can build that trust, and once they see that you are able to offer resources and tips and points that they may not have been aware of, then that gives you kind of an in. It gives you the ability to be able to provide that culturally responsive, and in my case, culturally responsive and trauma-informed care that our families so desperately need.
Thank you so much for that. Abigail, I'd like to pose the same question to you.
For me, one of the things that I try to do is try to inform the parents, one, that I'm not a parent yet, and that that since they are the parents and they know probably more than I do already, they already have all the experiences, they're already experts in their child, they know more than I probably will go in there. So when I go into a home visit, it's not me trying to get there and tell them what to do, since they see their children every day. They know their children better than I will know them. So I try to push them, let them know that they have strengths and that they know more than I will ever know, and that this is not what the help that I'm going to provide. It's also I'm not going to be there and to judge them or critique them, but to work together. And I think that's what Simone also mentioned, that we try to go in there and build trust, so we can have a rapport with the family, so they can know also that we're not just there just to do a home visit and then just to evaluate or judge their living situation. We're there to help them, and we'll bear their, if they ever need our help, they can also call us back or something like that. So I think that's what we try to work with.
I appreciate that.
Oh, I'm sorry.
No, you go ahead, Simone.
Say that it's so important for families to realize that we are there to help support. Support is key. We are not there to judge or to lay a framework of what we feel parenting should look like. It's more of a scaffolding. Mm-hmm. Where you're there to kind of build supports around what is already there. Exactly. Our individuals and our families come to us with a certain level of expertise, and they have a certain level of lived experience. So when you honor those things and you make sure that you that they understand that they bring a certain level of expertise and of love and of care, then they're able to kind of understand and bring and kind of take heed to the information that you're giving them.
That's so critically important. And I thank you for bringing that up, because one of the things that I tell myself all of the time in this work is that no one is an empty vessel. There are lived experiences. In the case of children, they're very closely tied and wed to that of their primary caregivers, and they're shorter, of course. But so much of the families and the caregivers' lived experiences are so incredibly influential and really at the center of what nurturing that child looks like. And so I thank you so much for bringing that up. We've got a nice supportive comment in the chat box from Christina Holtz-Crosby, who is one of the Healthy Steps specialists in the Charleston area, agreeing that trust and support is key. And I think that was a common theme that both of you hit on. and I think really emphasizes, I should say, just the critical importance of this work is that we have systems working together, early childhood systems, also medical systems, eventually schools, that are really needing to work lockstep and very much in tandem to support families and children in the best ways we know possible, and also across systems. So I always think that onus is on us as the professionals, is to create those systems that make it so that it's an easy access for families, that, you know, doing this work and getting these levels of support should not be something that's incredibly logistically fraught, time consuming, or cumbersome, that these should be things that we are embracing, you as a community member, your journey as a parent or a caregiver, and how we can support that by meeting you where you are and recognizing the strengths and the lens and the context to which you come to us and how we get to be involved in a relationship with you. So I think that was just such a beautiful way that each of you put that. I love the concept of resource sharing. In the Tri-County, we're fortunate that we're continuing to build systems where it makes that an easier thing to do. So, you know, certainly plenty of work to continue doing in that arena. And then the lived experiences, we talked about that quite a bit, and really honoring what it is that each unique family brings to the relationship that we get to have with them. And really hearing that, and not only hearing it, but making that part of our plan for the family, really understanding what those strengths are, what is sacred to that family, what is meaningful to that family, and any history that we need to know about, should they choose to share that with us. And then, of course, the non-judgmental kind of approach that we take. I do oftentimes worry that anytime we look at something as intimate as parenting, or the childbirth experience, or the prenatal experience, there's certainly a level of trust that needs to be established before we really can make those relationships as meaningful as they can be. And just really with that non-judgmental approach, and hopefully over time, we'll really get the message out there that these are actually ways to augment and strengthen parenting and families, and hopefully take away any kind of negative connotation, because everyone needs parenting support. It's meant to be done by a number of people, and not just a mom or a dad or a set of parents, but rather, you know, a community. And Simone, lastly, you mentioned one of my favorite ways to think about development and encouraging development really across the lifespan. So it's not just with children, but also with parents, with grandparents that are involved in children's lives, or elderly family members even that are involved in children's lives, and how we scaffold what's available within the family and within the community to best meet the needs of that child. So I just wanted to kind of sum some of that up and talk about how important it is that you shared each of those concepts with us. I wanted to move into our next question, and I wanted to have you describe to us how you determine family and child needs after assessing family strengths in the prenatal and then the childbirth moment, if that's applicable to the work that you do, and the postnatal period. So this is really getting to how you determine what needs a family or a child may have just by virtue of the proximity of the work that you do with them, because you are someone that's coming into their life who is designed to be a support person.
Well, I'll start. So the first thing that is necessary for me to do is to come in and ask questions. Never making the assumption that I automatically know what services and what skills and what tools a family needs. First, we have to kind of assess where they are and meet families there. So by asking questions and building relationships, and we have, you know, our certain amount of formal assessments that we do to be able to determine what needs and resources the family needs, but also being able to kind of assessing from visually, just by what we would see in a family and their circumstances. I find that a lot of times, so it's very important to understand that we need a healthy mom, a healthy family in order to be able to birth healthy babies. That's what's super, super important. So if we have a mom who is battling with where she's going to sleep at night or where her next meal is going to come from, we have to start with the basic necessities first. So just kind of getting a gauge of where those individuals are in their life experiences and being able to build upon that. So do we need to, I know we're going to talk about partnerships. Do we need to connect these individuals with resources prior to us being able to have our formal conversations in regards to what childbirth looks like, how our bodies work? No one's thinking about physiologically what the body needs in order to birth babies. If they're hungry at the moment, they won't be able to focus on that conversation if they don't have a safe place to sleep. What is that partner relationship looking like? There's so many different aspects that are important to gauge before we can even jump into the meat and potatoes of what we may feel what we may feel we're coming in for. Yes, they may need nurturing parenting skills, but what were their relationships like with their parents and with their families? Those things are so important to be able to recognize going first before we can then introduce the skills and the tips and the resources that we may have.
Thank you so much for that. I've got some good notes.
Well, for me, I think the first thing I try to do, like Ms. Simone mentioned, is not to make assumptions, but also ask questions. The type of questions that I ask kind of depend on, since sometimes I do work with families that are just recently arriving from the country, so their fears are a little bit different. So I do try to ask them if they already had a child, or if they are pregnant, if this is their first child in the country, because yes, they may have already had a child in their home country, but it's really different here. There's so many different things, and also the lack of, because of their language barrier, sometimes they don't understand the process, and then also they may have like lived somewhere else and lived in New York and then came here to South Carolina, and that's just also very different. So trying to explain to them, like, this is the process, this is what you have to do or you need in order to do, or this is what also is going to happen in the hospital. The hospital may ask for your ID. Do not be scared. This is kind of a normal protocol of asking for paperwork. So, and I think that also letting them know, like educating them know that this is things that are normal. So families don't have that fear of if they're asking for immigration status, they shouldn't ask for that stuff, or asking for just simple things, but also letting them know that they can ask for questions, that they can, if they're about to give birth at the hospital, that they can, if they have a complaint or they have something they need to share, that they can do it. They shouldn't be scared to ask for help, or especially in the hospital setting. So that's one thing I try to do. And then if I do meet them after birth, I'll still ask them again too, if they already had a child here, or if this is their first child, because they may have not known simple things like, how do I do to get a birth certificate, or what is exactly a social security number and why it's important. Explaining those things, but also continue, like Simone mentioned, making sure that they have the basic necessities of, are they connected to WIC, because they may not have the financial support to buy formula if they're going to do formula, or also provide connecting with WIC to make sure that they have enough food at their house, or connecting them with other services, or also trying just connecting them with different people in the community. And like Simone also mentioned, are there other organizations that they can help them? I think we're going to ask this question later on, but I think also working with other organizations is very important, because I don't think one organization is going to be able to help one family. Sometimes it's several organizations working together to provide help for one family, and that's okay that they need that help for now, and they provide services. So I think it's just talking to the families and also allowing them the opportunities to let them know that they can ask me any question, no matter if it seems like a dumb question, that they can always ask me, because I may, if somebody knows something, and also try to make sure, yes, they ask someone, but it can always be like, oh, my neighbor told me this, and it's not always the truth that the neighbor said, oh, that this could happen, that this is what my neighbor told me. And then I try to, like, if they ask me, well, I was like, that's not exactly true, or it is true. It just varies. So just ask, if they have questions, just still ask me and I can help them.
Yeah, that's so important. I think a lot of what we do in our work is really demystifying things. So making it, these are really complex systems. And there's lots of variables that influence how complex that system is for you. And those can include things like literacy levels, language, mastery, the number of years of school that you went to, your own mental well-being. And so all of those factors can contribute to how easy or how difficult it may be to work through the different systems that need to be in place to ensure that children have those basic needs met. So, getting all of the paperwork together to get a birth certificate, a social security number, these are things that I think oftentimes go overlooked that are of critical importance in order to have that child eligible for medical care. So before they can even grace the doors of an office like where I work as a provider, all of these things need to be in place. And so I think it's of no surprise to anyone here that it's individuals like Simone and Abigail and the community supports that we have in place that when those things are more challenging for a variety of different reasons for families, these are the folks that make it so that those children have a way to enter a healthcare system or enter a school system. These bigger systems that we know are so influential and important in their day-to-day life and their health and well-being. Some great comments. I didn't realize that Georgia Mjarton is with us. So happy to have you, Georgia. Thank you for attending our panel. And she just is highlighting the importance of giving people an outline of what exactly is going to happen and what to expect is so important. I think that, I often think of it as a healthcare provider. This is a way that we alleviate anxiety. It's a way that we help manage expectations. It's a way that we help a family, like the word that Simone used, scaffold care for their children and for themselves, really. So just really being there with just-in-time information about what steps come next, how to navigate a system, those types of things is so important. And then also Georgia weighing in and saying that, Abigail, you had a great point, and she also had many of those same experiences when she worked with individuals experiencing homelessness. And then she's saying that a great reminder to everyone that just yesterday, we launched a great tool to help families know about all of these systems and services and what they're eligible. And she's linked the first5sc.org and this just in time information. So thank you so much for those comments, Georgia. Those are really important things. One of the points that Simone brought up that I just really wanted to talk about a little bit more and really highlight, we are learning more and more through research in early childhood that one of the core components and one of the core virtues of childhood and development during childhood that really is seeming to be pretty predictive of some very positive outcomes later in life is a child's ability to get curious. So curiosity as a virtue of childhood is really looking and proving to be just a really important strength of childhood. And so if we can get children curious about, different things, art, music, all of the things that we know are contributors to later academic success, that's really important. And I wanted to just link that back because Simone brought up such a good point that as community advocates and as community supports, we also need to maintain that level of curiosity. I can't tell you how many times, and I'm sure that Simone and Abigail would agree with this, some of the times where I see families' faces just light up as brightly as I've ever seen them is when you ask them these questions about what is important to you, what is important to your family in regards to this child raising a child or having a child or being a parent. What's important for you to share with their older sibling, or what are things that you like to do together? What's meaningful for your family? What are some of your favorite foods that you enjoy? Because oftentimes, as Abigail mentioned, she and I work across cultures, or I work across cultures because I'm not a Latinx person. So asking those questions and getting really curious about what are and that's a great way to assess strengths too, because these are the fabric that really tie us together as human beings, frankly, because we think about these things that we enjoy. Now, my Italian family's food probably looks somewhat different than, other families, but these are just the really important questions to get curious about and to ask about. So thank you for bringing that up, Simone. I think that that's so important. And then each of you really highlighted the need to assess for basic necessities. And I always think back, there's a sociologist, Maslow, who developed a hierarchy of needs. And as you move up the hierarchy, you are thought to be more functional and to be able to be more autonomous. And this can be applied to childhood. Excuse me, it can be applied to adulthood. But unless those very basic things like nutrition, housing, and shelter are met, you cannot meet any of those higher needs. And so to Simone's example about how is a mom going to create a birth plan when she doesn't know where she's going to be sleeping that night, we can't possibly ask someone to think about those things that are happening to them in the future when they have very immediate and very, very dire needs that aren't being met. And then how can life experiences shape some of these things too? And I would go one step further and talk about, and I know each of us address this in our work, how do family experiences shape what we need to share? So, is there a child that's living in the home that might have a disability? Is that something that's influencing, this new baby's life or this mom's life now having to care for a child with special needs and also a newborn? And how does that affect the family unit as a whole? I love just sort of the blanket, don't make assumptions. Let's not assume that anyone knows or doesn't know something, but rather be curious, ask the questions, follow up, really get as thorough and authentic of an understanding as possible. So thank you very much for those really wise and just timely responses. The next question we wanted to talk about and we wanted to address is how does data around infant morbidity and mortality around the families that we serve in our state inform your programs and your overall work in the community? So given the nature of our summit this year, we feel as though it's of critical importance to talk about infant morbidity and mortality, also maternal morbidity and mortality, and how that may affect the families that we serve. So Simone, I'll let you kick us off again.
So it's very important the numbers don't lie. So when you think about that, and to put things into perspective, one of the things that's very important for me is understanding what the infant mortality looks like, but also we know that our infant mortality rates are very closely tied to what our maternity mortality rates are. So when you look at the maternal mortality rates, we have, if you look, right now we're in the midst of a crisis. We know that of our developing countries, the United States, we have the highest maternal mortality rates among developing countries. But also when you disaggregate that data, unfortunately, we see that our Black moms or moms of color are 3 to 4 times more likely to die as a result of childbirth-related instances. So that's very important when it comes to doing the work as a birth worker, and also my work with Berkeley First Steps and the B Collective. It's very important to be able to understand what those numbers are. So we know that our Black moms are 3 to 4 times more likely to die as a result of childbirth-related illnesses. But when you look at the infant mortality rates, we see that in 2020, there were 5.69% deaths per 1,000 births for babies. That's an alarming number in and of itself. But also when you break those numbers down even more, Black babies were 10%. We had a 10% mortality rate. So that those numbers were double those numbers of white babies. So being in the position that I'm in to be able to provide care for mothers and babies, that breaks down into the work that I do. As a doula, my job is to be able to provide physical, educational, and emotional support for these moms and families as they journey into parenthood. That looks like decreasing what our cesarean rates look like. That looks like improving overall satisfaction with birth. That looks like making sure that moms and families know their options going into labor and delivery. That it also looks like ensuring that our families have access to quality care, that they're making those prenatal appointments, that we decrease the amount of pre-existing health conditions that our families have, and that we take a look overall at our systems and how sometimes just the systems that are in place don't necessarily work towards improving those outcomes. So that's when we have to take an honest look at what can we do? What can we do as community members? What can we do as advocates? What can we do as birth workers? What can we do as educators? What can we do as parents to kind of take back the power and autonomy to be able to make decisions for ourselves, to demand higher quality birth outcomes, demand better quality in our rural areas? We know that in Berkeley County that we just opened our first birthing facility, a year ago, 2 years ago. So when you look at what that access or lack of access looks like for our rural families, we have to take into account how this contributes to the data. How does that contribute to our maternal mortality rates and morbidity rates? And how does that play into our infant mortality and our infant morbidity rates? How far do these individuals have to travel to get to a quality pediatrician? How far does an individual have to travel to get to a quality OBGYN? These are all numbers that we have to take a look at when we look at decreasing our numbers. We don't want any moms to die. We don't want any babies to die. So we want to be able to put ourselves in a position where we're educating our communities, but that we're also holding our systems and our hospitals and our providers accountable to be able to provide the service and the quality and access that they so desperately need and deserve.
Thank you so much, Simone. It's sobering every time I hear it. And I really thank you for sharing the data that informs the work that we do. And that's of critical importance. Thank you for sharing that with us. Abigail, I want to turn to you and pose the same question.
I think I feel like Simone answered the question very well of not only giving numbers for Black families, but also I think for the most part, when you look at the data, usually the Hispanic or the Latinx community is right behind the Black families. So I'm not going to really share much numbers. I think one of the things Simone already mentioned is connecting to the sources available, which leads to these numbers. But I am also going to mention also for development screenings, since I am also doing screenings mainly weekly, is that Latino children are less likely to be screened, and also when they are diagnosed, they're most likely to be diagnosed at a later age. And that's because sometimes with the pediatricians, if they go to the pediatricians, they don't get screened. Not all pediatricians' offices do the ASQ screenings. I know MUSC does, but not all clinics do. And then also, them not knowing the resources available that are connected in this area or the services that are provided here, that there is services available to help them. I know a lot of people in their home country, I think when they have a child with disabilities, I feel there's not a lot of support connecting to them, so they don't think there's organizations here connecting them to those resources and providing the support for families.
Thank you very much for that. I don't know that there's much more that I can add to that each of you haven't already said, because I think the numbers paint 1,000 words. And certainly are much of the catalyst around how we build programs and how we look for where there's gaps in the areas that each of you mentioned and the way that individuals are cared for. And then also how we can be sensitive to what the demographic information looks like around those data points, because that tells an incredibly important story and a story that is so worthwhile hearing and making changes to try to better things. It's not something that any of us should ever become numb to or feel as though we get complacent with. And I think Simone said it best, and I probably will repeat this in my head for the next several weeks as I do this work, and something that I hope each of you will leave this panel with having heard today. And that's, what can we do? What can each of us do as leaders in the community and folks that have stake in this work and within these families to change this? And who does that involve, and what does that look like? Because we have to do better than this. So I'm going to move to our next question. And I want to ask how you utilize collaboration within the Tri-County area. So we're using this as sort of our case study for this particular panel, since the three of us work in this area. That's the Berkeley, Charleston, and Dorchester counties, and across other First Steps programs to strengthen the work that you do to assist families in having positive prenatal and postnatal experiences. So Simone, I'll turn this to you.
Partnership is key. We know that we cannot do this work alone. We know that there are so many resources that are available that we just cannot do it all. We know that in order to be able to provide kind of those wraparound services, we have to utilize collaborations and partnerships with other agencies, other community leaders, other organizations to be able to do that. For that reason, we partner with a lot of different community resources. So our other First Steps siblings, so our Charleston and Dorchester siblings, we partner with DSS to be able to gain referrals, to be able to provide resources and to provide services to those individuals as well. Father to Father is another one of our partnerships that we look at, because we can not only just look at what our maternal resources look like. Our children need their fathers in their lives as well. And we know that that's very important to fetal development as well as childhood development as well. So making sure that our fathers are equipped with the resources and the information that they need to be able to parent in a nurturing and caring way as well. Another organization or agency that I'd like to highlight is the B Collective, or the Berkeley Early and Education and Care Collective. I am the community champion for that agency as well. And a part of our work is being able to expand the access for early child care, making sure that our families have access to quality child care, that we have maternal supports. We know that our postpartum rates or maternal depression rates are really high. So we want to be able to partner with our local just our local organizations that are being able to provide those mental health facility kind of services that they'll be able to provide. We want to make sure that our individuals are healthy holistically. So it's a holistic approach. We want to make sure that physically, emotionally, mentally, that these individuals have the services that they need. Recently, we partnered with Fact Forward to have a Let's Talk night where we talk about the importance of having difficult conversations regarding sex, love, and relationships with young individuals. So partnerships like that afford us the opportunity to be able to give the services and the information that we need. But going back to the B Collective, one of the major things that we're doing right now is we're beginning kind of a cohort. Yes, I am a doula. I'm a doula of color, but we need more doulas and more doulas of colors and more birth workers of colors, more indigenous birth workers as well, to be able to provide kind of the nuanced care that our families need and that they deserve. So we're going to be opening or creating a cohort of doulas where we're going to be able to provide funding for other individuals who may not be able to afford it, who have a passion for their community, who will be out to also do the same work that I do, to be able to provide kind of that childbirth education, to be able to provide that physical, educational, and emotional support, to be kind of that hands-on in your face type of care where we check in, monthly, at least monthly, with our families to be able to see what they need. So I think that that's very important, just to highlight that there's so much expansion going on right now and so much partnership, because not only is it a first steps kind of challenge or initiative, but we have other organizations that we partner with that we want to be able to provide as much resources and tools and tips as we possibly can.
Thank you so much, Simone. I think you've answered that question beautifully and really highlighted the need for us to all keep in mind that none of us are islands, that this work is best done when it's done in collaboration and really being cognizant of what each family and children's needs are. So Abigail, I want to turn over to you and have you share with us your thoughts.
I agree with what you said about that our work is we're not an island. I think without all the other organizations that I work with, I don't think I'd be able to do my job. I like the connections that we have with Healthy Steps, which is located in the clinic, Healthy Families America, which is also located in the clinic, Family Nurse Partnership, or other organizations that are outside. I don't think I could be able to provide the support that I provide to families, connecting them with the other resources. An example is like I have been working with a mom who I met her when she was pregnant, and I helped her connect her to the resources to emergency Medicaid, and also connecting to WIC. But I also, because of my connection with WIC, that I know somebody at the office, I'm able to provide like a warm handoff greeting to her, so she's not like, oh, I'm not just like go to the WIC office and talking in the fear of not, but actually giving her a name of where she could connect somebody with. And then also recently she just called me to let me know that on Thanksgiving she had her baby, and also I unfortunately could not be there for her first home visit, for her first clinic visit, but I was able to call Lorena from Healthy Steps and say like, hey Lorena, I have this mom she's asking a lot of questions, and I was able to provide information, but sometimes the questions at providing support over the phone is not the same thing as me talking to somebody in person. And I was able to ask Lorena, do you mind going to her during her visit and talking to her and helping her provide these, or kind of just repeating the information that I'm providing. And she did that, and she was able to provide the support, more support than probably like that. But it also allows the parent to see that there's other people that are willing to help. There's not just Abigail that wants to help, but there's other people from other organizations and other people from different that want to provide these services to her, that she shouldn't be afraid to ask for help. So I think that's one of the things, like all these organizations are working together and making sure that the families are supported, but also making the families have this understanding that they can ask questions and they can connect with these services, but also making sure like all these organizations are working together. And I don't think there's ever like a feeling of ownership towards these families, of having the understanding that some families may need all services that are available to them, and some families just need one services available to them, and that's okay. Like making sure that we're just making sure that their needs are met. That's okay if she's working with somebody with Healthy Families America, which is providing more in-depth home visits than I can provide. Yes, I provide home visits, but they're not as constant or as frequent as Healthy Families America, and they provide those supports that I can't do that. And also making sure that that's okay, like that she knows she can work with that family. So I think and then even the clinic also being very flexible, and when I meet families, this is also resources for children. Recently, we had a high number of children getting suspended due to lack of vaccines, of them missing their vaccines. And since I have a good connection with MUSC, I'm looking there, I'm kind of able to connect them to get an appointment, or also calling if they need helping them make an appointment with the DHEC, but also if they needed the vaccine card. Sometimes over the phone you can't get a vaccine card, but I can go down the hall to the DHEC office and ask somebody, hey, I made an appointment, can I get a vaccine card? Or the parent can come pick up a vaccine card, the appointment card, so they could give to the school so their child don't miss school. So these are it connects services. And also, like I said, I don't think I could do my job without all the other amazing organizations that they are providing support for me, and also support not only for me, but also for the not only the support for parents, but also support for me. So I also don't feel stressed like that I am alone helping this one family. Like, no, if I also know that if I need help with the family, that I can ask for help, and then also making sure that I'm not taking all the stress from the particular family and working, and that also helps me continue to do better my job too.
Thank you so much for sharing each of those experiences. And I think that many of the things that you highlighted, that this isn't something that you do in isolation. I think that that's a really important point to emphasize, because when we do this in isolation, the biggest risk is that this work becomes unsustainable, because it can't be about one person or one program, and it's not a one size fits all type of job, but rather a collaboration and sort of the dance that occurs between different programs when we assess for needs and we think about how we best meet those needs, and really making those linkages between where there may be a need for a family and what program best fits that need. And, we affectionately in the Tri-County area call it our ecosystem. So we have a family that we work with, and we identify, what the different needs may be and how the different programs that we have available to us in the Tri-County area within our early childhood ecosystem may best meet the needs of those families. And so it really takes the interaction between all of the systems that the family may encounter. So the systems that are of the biggest impact within those first 5 years of life, and then also going back into the prenatal period. And that relies heavily on the medical system. It relies heavily on the educational system. And then, as Abigail and Simone have both mentioned, those interface directly with things like housing and Social Security. And for some children, getting disability benefits if they have disabilities. So all of those different systems that are impactful in those children's lives. So I just thank you so much for sharing that. And one of the things that I think each of us would say anecdotally is that we know and we see firsthand that when we display this level of compassion and interest and stake in a child and a family's life, there's an incredible spillover effect that occurs. So if you've got a home visitor coming into your home and knows your child and knows your family, and you've got a doula that has followed you through your pregnancy, that knows your history, that knows the relationship that you have with your partner that resulted in pregnancy, the likelihood that person that has had that baby, or that couple that has had that baby, feels as though they have the capacity by which to care for this baby as authentically and as well as they possibly can, is really impacted by the support that they get from the outside. So the level of energy, the level of compassion, the level of understanding that we're able to give to families really gets returned to us, because they're then able to pass that on to that baby, and they're making really informed decisions every day on the care that impacts that baby's life and makes them the ready kindergartner that we talk about, or the good reader in third grade, whatever we want to assign as our measures of success. Those are things that we're teeing up early on to make sure that we've got those supports in place. So we do have a couple of comments that I wanted to get to. Gina is saying that she agrees that connections and warm handoffs are so impactful. And I think each of you highlighted that on such a high level. And that Crystal is saying that she loves hearing more about each of our expertise and then dedication to the community. Thank you so much for that, Crystal, and thank you for your work. She does have a question for Simone. And she's saying that people may not know that a mother doesn't just receive doula support at home or for a natural birth. Can you talk about the doula experience for a mother who chooses an epidural? Also, can doula services be provided for a mother in preparation for a C-section? So I'll have you answer that question, and then we'll move on to our final panelist question.
Okay, thank you so much for that question, Crystal. Sometimes in the work that I do, I kind of don't realize that sometimes I have to break it down just a little bit more. Doulas provide, assistance to families who are going through all types of different birth experiences. So whether it be a home birth, whether it be a hospital, whether it's a scheduled cesarean, we're able to provide that individual what their options are at each stage or at each step. So I go in and I meet with them at least 3 times prior to them giving birth, just to see what their expectations are, whether that's in preparation for a home birth or a hospital birth, just to give them their options at different points, help them to devise a birth plan for what their preferences are going into labor and delivery. And especially in a hospital setting, that's so important for moms and families to understand at what point should I get an epidural if I'd like to get one, and just being able to talk to them about the facts and the statistics. We know that if a mom waits until she's at least in active labor, then to get an epidural, then that decreases her chances of getting a cesarean by 30%. So just by giving them that information and being able to talk them through what their options are. And especially with the cesarean, I have one coming up where I'm supporting a mom who has to have a scheduled cesarean because of past birth experiences. So I will be talking with her and still devising a birth plan, letting her know what her options are, what she should expect as far as breastfeeding her baby, what she should expect postpartum, and what supports she should have in place, whether that be a postpartum doula, whether that would be what her family dynamic looks like, making sure that she has meals, making sure that she has someone to care for her, as well as the baby in those circumstances. So doulas support way more than just home births. We support all births. And there is a doula for every mom who wants one. And that's what I believe. So I thank you for that question.
Thank you for that. Thank you for educating us about the importance of the role and how versatile the role is. I'm learning so much. Thank you, Simone. So I want to move on to our final panelist questions, and then we can open it up more broadly for any questions that still may be out there from our audience members. And our final question, in line with what we're talking about and what is so important about the summit, is knowing the science behind the critical first 3 years of life that include children's built environments, interactions, and experiences. What are your hopes for families and children that you work with now? And what inspires you to both continue and grow this work?
I'll let Abigail go first this time.
Okay. Thank you. I think for me, my hopes for families is to make sure that they, as one of the goals for my program is making sure that children are ready for school. So my goal is for making sure that every kid, all Latino kids are prepared to school. And that not only means like making sure that they're learning the stuff that they can do, but also that the parents feel comfortable going to school. A couple years back, last year we did Countdown to Kindergarten. And I think one of the things I learned was when we were asking parents, like, what do you want to learn about kindergarten? What do you want to learn? They were asking me very basic questions like, what did they do during lunch? Or what about snack? Or what about nap time? And I think, and also parents want to participate and want to learn, how exactly are they taught in school? Because I know it's very different compared to their home country. Sometimes in our home countries, we're taught the vowels first before we were taught the actual alphabets. So to them, when I'm doing the sessions, they're like, they were kind of amazed to learn that we first focus on alphabets instead of the vowels, and I explained to them or like little stories that they're constantly heard. So I think my goal is to make sure that the kids are ready, like that and also parents feel comfortable dropping off their kids at school, and they feel comfortable enough going to the school if there's a concern and asking them questions, and then also that they feel comfortable that if there's ever concern, they can go to the school without any fears of and they can ask questions. So I think that's what I may want to go. And then what continues my work is just basically, I love what I'm doing, and I also provide based on what my experience is as like a first generation Latina and what I saw when my mom was doing all this by herself and making sure that I can provide the same support. Just as I knew a lot of people, as my mom, when I was growing up, I know a lot of people were providing the support for for my mom and my parents. So I want to make sure that there's someone also when the children are there, they can have the support that they can have too, that they can see.
Thank you so much, Abigail. I love the personal connection to the work too.
Thank you.
Okay, so for me, my overall goal is to ensure that all families get the support and the advocacy and the quality service that they need while improving birth outcomes, maternal outcomes, infant outcomes for all moms and all babies to be able to thrive in an environment where everyone feels loved and cared for and supported. The thing that keeps me going is just my passion for this work. I too have a personal connection in that I was a teen mom. I needed these supports. I relied on these same services and resources that I talk about. And I know that for me, having the support, having my mom there and supporting me through, being a young mom, I think that in turn, I want to be able to do that for other families. So many families do not have the love and the support and the care that they need in order to thrive. And if not their family, then who? And for me, and sometimes I get really kind of choked up when talking about it, I'm sorry. But for me, it means that if not me, then who? So many of my families don't have anyone else. And if not me, and even if that means that I have to step outside of my role as a doula and just be a friend, then that is what I will do. So one of my life's mottos, if not me, then who?
Gosh, I love that, Simone. You've left me with so many words of wisdom just to carry through in this work that we do. And I think that this panel has been incredibly representative of the way that we hold one another up. And while we hold each other accountable, we're also encouraging each other to continue to grow and to help others grow, and really looking at what exists in the community and what strengths are there, because boy, there's tons of them, but also understanding where we can make an impact and where there's still things where we lag behind and why there is still work to do. And I just am so appreciative of this time that we had together. And I realize we're 3 minutes over. Obviously, we could talk about this all day. And so I want to just hopefully get to these questions really quickly. Is that okay, Gina?
Yeah, we have questions in the chat box.
Okay, yeah. So I wanted to get to those. So Crystal thanks you, first of all, Simone, for your eloquent response to her question. And then Crystal has a question for you, Abigail. In your work with refugee and immigrant families, are you initiating the connection with them, or do they seek you for services? What is turnaround period for connecting, or what is the turnaround period for connecting, excuse me? And is there a process? And what is a key thing to remember, consider when working with a new and refugee immigrant family?
So
a lot. That's a lot, right?
So I think it varies. There are organizations that reach out to me when they're needing help, but I think for the most part, most of my referrals are from actually families individually contacting me, and usually it's from like they say, oh, a friend or one of my somebody else that's lived here longer gave me your number and said that you could help me connect with resources, and then that's based on what the resources that they need. If they needed, like if they just recently moved here and they have no furniture, connecting them to services, and that's pretty quick. But if it's other services, sometimes I do ask for helping or connect with legal stuff, and that does take a little longer just because of there's a lot of barriers, or it's harder to find resources for those things. So I think some of the stuff with that, so that does take a while longer. And then another one is sometimes when people do contact me when they're just recently arrived, is when they're trying to get their children enrolled in school. So that it just varies. Sometimes the process is a lot quicker because all the paperwork's there, and other times it just takes longer because of barriers of finding places to get vaccines. And then also, if they usually are recently arrived, they're probably going to move in with a friend or someone that they know, and then nothing is in their names. So it's harder to get, schools require proof of address, two proofs of address. And if they don't have that, they have to get it notarized, and then that person has to go to school with them. So it just takes a longer process. But I think what to remember as when you're working with new families or immigrants or refugee families is to have just patience, because they're just learning everything. And they may have, depending how they came here, they may have been through a trauma getting here. And that's sometimes always remembering that they're gonna learn everything new. Everything here is so different compared to their home countries. And then sometimes it's hard feeling like there's no one that speaks their same language when you're going to a place, and being afraid of if you can ask those questions. And then also, just like I mentioned, the traumas of them, it's already a trauma in itself just to leave your home country, leave everything behind, and try to come here for a better life. So it's just, I would just say patience, and then try to make sure that they feel like they can ask those questions, and that they can call you for support. But thank you, Crystal, for the question.
Thank you for sharing that. And one last question in the chat from Ana Pavon Enriquez is, she says, "Hi, ladies. This question is for Simone. Do you currently have bilingual doulas, or can you share resources of how we can connect families to this service? Recently, I experienced being physically alone during the whole birthing process, and it really helped me reflect and think of the families I serve and what resources I could provide to connect expecting moms to have this type of service."
So currently, and this presents an opportunity, Anna. We do not have any bilingual doulas right now, but as I mentioned before, I partner with Berkeley Early Education and Care Collective, which is the B Collective, who has funding for other individuals who have a passion for birth, or who have a passion for moms and families to be able to become doulas themselves and to be able to train. So if you could message me personally your email address, I would love to be able to speak with you further. The NBDA provides kind of a culturally responsive training opportunity for women of color who would like to be able to support and advocate for moms and families throughout the birth process. So I would love to be able to talk to you further if you could send me your email address. But the B Collective, we will be working on expanding and recruiting other moms and other individuals who want to become doulas themselves. So this presents an opportunity either for yourself, or if you know someone else who may want to become a doula, the opportunity to be able to do so. So the NBDA is wonderful. There are other training organizations like DONA, which is the Doulas of North America, and Pro Doula. I really like working with the NBDA, as in they provide a culturally responsive training to be able to know how to provide care for our moms and families while they're going through the birthing process.
And what a great way of pulling it all together, putting that opportunity out there, and we have interest. So hopefully you can connect with Anna, Simone, and be able to talk with her a little bit further on that opportunity. Okay. Amy, any last words from you? Or
I want to thank each of you for being here with us today. It means so very much to each of us. We are fortunate to get to work with each other, and getting to talk about this work with each of you, and the prospect of expanding it throughout the state is just incredibly exciting to all of us. And we thank you for your time. We thank you for your attention. We thank you for your great and well thought out questions, and look forward to continuing to work together.
Couldn't have said it better myself. This has been wonderful. Although we went over by about 10 minutes, everyone stayed on and was really invested in the conversation. You guys, it was wonderful. I'm going to invite everyone to come back in 5 minutes for our ending plenary session. We are going to be hearing from Tiffany Nolan Boykin, and her presentation is called Wade in the Water. So come on back and join us at 11:30 for the plenary. And again, ladies, thank you so much. This was fabulous.
Thank you, Gina.
Thank you.
Great moderator.
Have a great day.
Thank you.
Thank you.
Bye, everybody.